Intuitive Therapeutics presents IntuitivePlan for Gamma Knife. In close collaboration between engineers and clinicians, Intuitive Therapeutics has developed the first inverse planning system based on a full convex optimization algorithm and artificial intelligence. This technology allows an efficient and quick computation of the optimal plan according to defined constraints. By allowing the user to act directly on the treatment plan, IntuitivePlan represents a true revolution. The skills and experience of the physician are thus transposed through mathematical rigor. The classical inverse planning approaches for radiotherapy do not allow neurosurgeons to adjust dosimetry like they adapt their procedure during a microsurgical intervention, mentalizing anatomical structures in order to increase or relax the constraints. IntuitivePlan is therefore particularly suitable for neuroradiosurgery as well as for radiotherapy. IntuitivePlan is a fast, reliable, and versatile inverse planning solution, including for multiple targets. Once the target and the dose are defined, IntuitivePlan allows the user to choose to favor selectivity, coverage, or a short beam on time, and different plans may be obtained. It is also possible to fine-tune sliders in case of specific needs and situations. IntuitivePlan is thus designed to give physicians the full control over the dose profiles through its unique planning features. The computation can take between 30 seconds and a few minutes, depending on the complexity of the case. IntuitivePlan shortens planning times and the duration of treatments, which represents a significant benefit for the comfort of the patient and for the team, as well as a potential economic gain. But IntuitivePlan does much more than that. By directly manipulating isodose lines, the neurosurgeon is able to quickly and easily adapt plans to minimize risks and increase efficiency based on his expertise and knowledge of the local anatomy, as during microsurgery. There is no need to define all the organs at risk beforehand or to redraw others during the planning procedure. IntuitivePlan will then recompute a full optimal new plan. IntuitivePlan has been tested in comparative studies by users considered to be amongst the most experienced. Dr. Jean Régis, professor of neurosurgery at Marseille University Hospital, performed a comparative study on vestibular schwannomas.
In a prospective series of gamma knife radiosurgery for vestibular schwannomas, we compared my planning to the one generated automatically by the inverse planning of Intuitive Therapeutics. This trial demonstrated that the dosimetric indexes were not inferior to mine, with a clear time advantage.
Ian Paddock, chief physicist at the Queen Square Radiosurgery Centre, London, performed a comparative study on arteriovenous malformations.
IntuitivePlan creates plans constructed with isocenter configurations that, as an experienced planner, I wouldn't even dream of. It's able to manipulate hundreds of isocenters and can often produce a technically superior plan to that from an expert planner.
IntuitivePlan is CE marked and is available in Europe for Gamma Knife. Developments for other machines are underway. Please do not hesitate to contact us if you would like a demonstration. The future is intuitive.